do this video on another serious matter, and that's cancer. But there are some information, educational, and also some signs. So the sign for cancer, you can spell it C-A-N-C-E-R. I do this sign. Remember, this is our backboard in a sense, and then it's just like it's eating away, right? So I use this for cancer, and I see a lot of people do this, eating away. And that's what it is. You know how you're biting or chewing, and that's what cancer, that's the sign for cancer, here or here. I just have a tendency, I've seen both, and I see both on a regular basis, but that's just my preference. And so it doesn't matter. You can do this, you can do this. It doesn't really matter. Or you can spell it, you know, if you can't remember that sign, so cancer. And so there's many different kinds of cancers. In fact, you can have cancer anywhere in your body. But we're going to discuss the most common, I guess. And we'll talk about the stages of progression. I use this a lot. This is an English sign for stage, or on this stage, right? If you are performing on the stage or you're standing on the stage, this is the sign for stage. But this is different. So this is like a stage of progression. So I would use that for stage of the different cancers. So let's first go over some of the cancers, or the most common. And like many of the of medical terminology, you have to spell it. But there are some signs and some classifiers. So the first one, of course, this is October, and so it's breast cancer. And so you just, with your bent B, go from one breast to the other, breast cancer. And that is the most common. We'll talk about the stages in a minute. And then people, I put it on here so I won't forget, you'll have a lot of colon cancer. You can spell it, colon, C-O-L-O-N, or here's your colon, right? Your digestive system, so you can do colon. You can, and it doesn't really matter, but you're just wrapping it, right? That's how your colon does, it wraps. And so you can say colon cancer or colon cancer. That's very common. And then lung cancer. So now we have like our C hand shape, and we're going to do this where our lungs are. I used to do lower where your lungs are, which is behind your breast, and I had one man say, well, you're going on down to your breast. And anyway, so lung cancer. So you've got your C, lung cancer. Prostate cancer, I mean, that is in a lower area of the body for a man, and so you can, this is the sign for testicles. You could do testicular cancer and prostate cancer, but most people spell it. Some with a deaf don't know, but if they have it, they'll probably know how to spell it. And it's for men. Women do not get prostate cancer or testicular cancer, but men can get breast cancer. Liver cancer. The liver is over here, and so you can do an L for liver. If you want to spell it, you can. Liver cancer. Kidney cancer, and if it's only in one kidney or the other, you can just do kidney cancer, or if you do kidney cancer, it's probably the left kidney, unless that person is left-handed. So a K hand shape, kidney cancer. Pancreatic cancer is over here. I usually have to spell that one because most people don't know that it's over there, right? The pancreas. That's just a really organ that we don't really discuss a lot, but most of the time that is fatal. It's a very dangerous cancer. Bladder cancer, and that's, you know, it's over here, but I would also spell it because a lot of people don't know. I mean, if it's heart or a lung or the breast or the kidney or the liver, those are easier, but the ones that you don't know, like a bladder, or exactly where that is, or people don't know exactly where that is, I would spell that, bladder cancer. And I would have somebody do bladder before, but I didn't know what organ they were talking about. So bladder cancer. Cervical cancer. It is for women. You can sign, this is the sign for vagina. It is not triangle. Please don't do that for triangle. Triangles with a T and you make it the shape of a triangle. This is vagina, and it's inside there. I would almost do this more or spell it cervical. So it's in there going, oh, okay, it's in there. Because it's kind of hard to describe, unless you're a doctor, you just don't see it. Ovarian cancer, now you can sign that with classifiers. So you've got your Y hand shape. This is your uterus. This is your fallopian tubes right here. And so if you have your an O hand shape, and it's not really ovary, it's the shape of the ovary, right? So you have your ovary on top of here and ovary on top of here. So you can do ovarian cancer. Ovarian cancer. If you have uterine cancer, then it would be here, uterine. Your cervix is down here. You could do that. You could do this for cervical cancer, uterine cancer. So this for a lot of women. So cervical, uterine, and ovary cancer. And they may remove it. This they're going to remove. The ovaries they're going to remove. If it's necessary. So that's a good classifier for a lot of these female cancers. Thyroid cancer, you use your T hand shape because it does start with the T for thyroid, and it's over here. Thyroid cancer. Thyroid. And also do the cancer sign, thyroid cancer, because it may just have a thyroid issue, but cancer. Then a skin cancer. So skin, you're just kind of like pinching your cheek. Skin cancer, because you can have skin cancer everywhere. So you can say skin cancer and then say here or here or here or whatever, wherever that is, because your skin is all over your body. But do skin cancer, and then you can point to where it is. Skin cancer right here or whatever, wherever it is. Then you can head and neck, bone cancer. The head and neck, esophageal, that would be here on your neck, right here, neck cancer. Throat cancer, people have that, throat cancer if they've smoked or chewed tobacco, those kinds of things. Bone cancer. Bone cancer. You could also do bone cancer, so you might see bone, spinal, so in your bones. Those are kind of dangerous. And then I had a thought about where else, the esophageal, head and neck. Those are the most common ones. If I think about it, I'll do that. Oh, lymphoma. You would have to spell it. And if somebody says, what's that? The lymph, and you could put like underneath your arms, because they're in different areas of your body. Lymphoma is also kind of a dangerous one. If it gets in your lymph nodes, it's kind of dangerous. Leukemia, who knows how to spell it? But I would do a blood cancer, because that's what leukemia is, a blood cancer. So now we've gone to the types of cancer, the different, and the most common, but like I said, you can have it anywhere. So the symptoms are fatigue, tired. You can have like a lump, anywhere that oh, I was doing a breast, exam, or had a mammogram and they saw, a lump. The colorectal. This is your anus, and so that would be for your rectum in there. Okay. You can have a sudden weight loss or a sudden weight gain. Sudden weight gain and weight loss, because that makes sense, right? You're going down for weight loss and going up for weight gain. Your skin color changes. And people say, well, what do you mean changes? Well, maybe it's yellow, or maybe it's dark, or maybe it's red, or maybe there's a sore remember, this is kind of a classifier. And so if you have, remember we did button and we did coin, and if you have a spot and it never heals, those are the kind of indications for, that's a symptom for cancer. Or if, like, when you have a bowel movement, so here's your body, where it comes out, and then your poop comes out, and if there's blood in your bowel movement, that is a symptom. So poop, blood. They'll say, a doctor will say, is there blood in your stool, right? So I would do stool and then blood. Blood in your stool, or stool, is it blood or is it red? Yes. If you're having problems swallowing, that could be a throat or a thyroid issue, something that's encroaching upon the swallowing, or a breathing. So you have lungs, or if you're breathing, right, it's more relaxed. If you're breathing and you have problems breathing, or breathing shortness of breath, I usually start out with problems breathing, shortness of breath, like, sometimes you have to act it out. So people will understand. Hoarseness, a deaf person's not going to know about that, and you may or may not notice it. Depends on how they speak. Or if it's just, if your stomach is upset all the time, or all the time, or like, oh, I have pain, or in your knee or your leg, if there's just constant pain that was never there before, and they can't find a reason. If you're bleeding in different areas, or you bruise, it's purple or blue real easy, that can be a reason. So those are the symptoms. So now let's talk about some of the stages. Stage. So stage 0. And you're thinking, oh, yay. And pretty much yay, right? And so that's called pre-cancer, or it hasn't spread. Maybe there's just cells there that are not normal. And that's what cancer is. Cancer cells that are not normal, they're growing for no reason. There's no reason for them to be growing, and those are the cancer cells, and they want to take over the regular cells. So that's what stage 0 is, that they have pre-cancer cells. There's more cells that are kind of multiplying, and they should not be there. And that's also called, they call it in situ. It's inside, and that's many times that's for breast cancer. They'll say, oh, it's stage 0, and so they can usually easily get that out. And they can normally, if they see that, they can cure that fairly easily. Most of the time, not always. So anyway, then stage 1, that's when you have cancer and it is small and has not spread. And it's referred to as localized. Localized. It's in one area. Small. Okay. Then we have stage 2. And you only have to do it like stage 2. You don't have to keep going stage. So stage 2. And that means that it has grown. I would not say grown. I would say getting bigger. It has grown. And it may be it's starting to spread, or it goes into your tissue. Tissue is kind of intruding inside. It's kind of spread and getting in to your tissue. So that's stage 2. Stage 3, the cancer is locally and it's advanced, and it maybe have a tumor. So that's usually, its growth, stage 3. But there, most of the time, it is still the local in the same area. It's gotten bigger, and there's normally a tumor. Um, but it's not spread into different organs. Now, stage 4, that has spread, metastasized. It has spread. You don't have to spell that word because it means it has spread into other areas, or like it has spread into different organs. Or like, for example, for breast cancer, if it has metastasized, it has spread into the lymph nodes. Maybe it's usually like underneath your arms, wherever they are, that lymph nodes, and they're all over your body. So it's getting in there. Sometimes I had a friend years ago, it had spread into her bone. It was still breast cancer, but now it had spread inside her bone. And she did pass away. I have another friend now that is deaf that has breast cancer that has metastasized, and but it's in her lymph nodes. So she still goes to treatment. She takes care of her kids. So she's always cheerful and positive. So optimistic. This is mind positive. That means that you are optimistic. Okay, so if it's like, for example, if it's a kidney cancer, it may spread into the stomach or the colon. It can spread, metastasize. So if it's in a different area, a different organ, it has spread, there's a tumor, then yes, like liver cancer, it can spread, all over to the liver, which is dangerous, and it can spread outside the liver. So any cancer can spread outside that where it first began. So I had someone that I knew that their mother had brain cancer, but it started with breast cancer and had moved brain cancer. And so normally it's not curable at that point when it spreads like to the brain or to the lungs, those type of things. But so that's why people are very insistent that they go to the doctor and check so they can catch it really quick. So hopefully you can, because some cancers don't have symptoms that you can see or feel immediately. It has to be worse, where you see like blood, or you feel, a lump, or something, that you can feel that. So anyway, I think that's, all the stages. There's different treatments. We already said chemo, because it's your IV. The medicines either going into the IV or the port. Radiation. I've had 2 friends that have had lymphoma, and it's radiation, and depends on where it is, and they are cured. So we want to stay optimistic about that. So you have radiation, and it depends on where it is on the body. Does it go all the way down here? Is it localized? So radiation, because it's the rays of that machine. You can hear it, yin, 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 yin. So you have radiation. And so those are the 2 treatments. Sometimes I had another friend, she had ovarian cancer, but they had given her some oral medication, and she's cured from that. So there's different. I had someone else that had prostate cancer, and they went to Washington, and they had a seed. They had seed pods. That's what they called it anyway, and that they put in there, and then he was cured. So you just never know the different treatments, and always ask for the different options that they have instead of only the chemo and only the radiation. Do they have oral? Do they have seed? Do they have, what's the different kinds that they have? And so the different chemos, you'll have different reactions, response. You have R for response or reaction. Their side effects. So always ask the doctor, always ask for the material and read it, because most of the time we don't read it. So it's easier sometimes just to ask the doctor, ask what's the diagnosis, DX, what's your prognosis. I had another woman who was deaf, and she had ovarian cancer, and she was a little bit older, and so she asked about her prognosis. So if you don't know how to spell that, prognosis, PXDX is diagnosis. That's how they write it. And so you can ask, what is the percentage of curability, right? Percent cure, what is it? Or those types of, or how many years do I live? Will I die? So a Southern way of saying die is to this. People think it's a disappearance, but it can be, but it also means to die. So make sure that you ask, and if it's your friend or a family member, you can be very supportive. Take care. Ask questions, go to the doctor with them, because they may forget. There's also some vitamins and minerals they can take. Also, they need to stop smoking or stop drinking, and eat more healthy, and that'll help their body fight off all these different side effects from chemo and radiation. Anyway, I hope this was helpful, and just the information in general, and plus the signs that go with it. So I hope you have a good day, and I will see you later. Bye.